The human body has a remarkable ability to communicate potential health concerns through various signals, and one of the most important yet frequently misunderstood indicators involves our lymphatic system. I'm Dr. Lena Morgan, oncologist and specialist in early cancer detection, and today I'll guide you through the critical differences between harmless lymph node swellings and those that might indicate a more serious condition. The lymphatic system serves as our body's natural filtration and defense network, with hundreds of bean-shaped nodes strategically positioned throughout the body, particularly concentrated in the neck, armpits, groin, and abdomen. These nodes house immune cells that help filter foreign substances and fight infections. When functioning normally, these nodes remain small and undetectable. However, when confronting infections or other threats, they can enlarge as they produce lymphocytes to combat intruders. While most swollen lymph nodes represent normal immune responses to minor infections or injuries, occasionally they may signal something more concerning. The ability to distinguish between benign swellings and potentially malignant enlargements could lead to earlier cancer detection and significantly better outcomes. Let's explore the 4 key characteristics that help differentiate between these scenarios, equipping you with knowledge that could potentially save lives. Size matters. Understanding lymph node dimensions. The first and most obvious characteristic to consider when evaluating lymph nodes is their size. Normal reactive lymph nodes, those responding to infection or inflammation, typically remain relatively small, often comparable to a pea or small bean, approximately 0.1 cm in diameter. Even when swollen due to infection, most benign nodes rarely exceed 11.5 centimeters. In contrast, cancerous lymph nodes frequently grow significantly larger. They may reach 23 centimeters or more in diameter, roughly the size of a grape or larger. This substantial enlargement occurs because cancer cells either originate within the node, as in lymphomas, or migrate there from other primary sites, metastatic cancer. As these malignant cells multiply, they displace normal lymphatic tissue, causing progressive enlargement that exceeds typical inflammatory responses. Another distinctive feature regarding size is the node's relationship to the skin surface. Inflammatory nodes usually remain beneath the skin, palpable but not visibly prominent. You typically need to press on the area to feel their presence. Cancerous nodes, however, can become so enlarged that they create visible lumps or protrusions, sometimes even distorting the overlying skin. This visible protrusion represents a particularly concerning sign that warrants immediate medical evaluation. Consider Sarah's experience. She noticed a small, tender lump below her jaw while fighting a tooth infection. This pea-sized node disappeared within 2 weeks of antibiotic treatment. In contrast, Michael discovered a grape-sized, painless lump in his neck that continued growing over several months until it became visibly noticeable, even without touching it, a classic presentation that led to his lymphoma diagnosis. The time factor. Duration of lymph node enlargement. The second crucial differentiation factor involves how long a swollen lymph node persists. This temporal pattern provides valuable diagnostic information that helps distinguish between benign and potentially malignant conditions. Inflammatory lymph nodes typically follow a predictable timeline that correlates with the underlying infection or injury. When you develop a throat infection, for instance, cervical neck lymph nodes may enlarge within days of symptom onset. As the infection resolves, either naturally or with appropriate treatment, these nodes gradually return to normal size. Most inflammatory enlargements resolve within 23 weeks, though occasionally they may persist for up to 46 weeks in cases of more stubborn infections or inflammatory conditions. Cancerous lymph nodes, by contrast, demonstrate persistent enlargement that extends beyond the expected inflammatory timeline. A node that remains enlarged for more than a month, particularly when it continues to grow rather than gradually shrinking, raises substantial concern. This persistent enlargement occurs because the underlying cause of malignant cell proliferation continues unabated. Unlike the self-limiting nature of most infections, the persistence factor becomes especially significant when combined with a lack of other infectious symptoms. When Maria developed swollen nodes under her arm accompanied by fever and a skin infection on her hand, her doctor wasn't particularly concerned. However, when James noticed a painless neck lump that remained unchanged for 2 months despite having no other symptoms, his physician immediately ordered further testing, which revealed Hodgkin's lymphoma. Mobility assessment. Fixed vias. Freely moving nodes. The third characteristic, and one requiring physical examination, involves the mobility of the enlarged lymph node when palpated, examined by touch. This feature provides important information about the node's relationship to surrounding tissues and offers valuable diagnostic clues. Normal lymph nodes, even when enlarged due to inflammation, typically remain mobile within the surrounding tissue. When you gently press on these nodes, they slightly shift position, sometimes described as feeling slippery under your fingers. This mobility occurs because inflammatory nodes remain confined within their capsule and haven't invaded surrounding structures. They essentially float within the soft tissue compartments that house them. Cancerous lymph nodes, however, frequently demonstrate a concerning characteristic called fixation. These nodes feel firmly anchored in place when you attempt to move them. This fixation occurs through several mechanisms. Malignant cells may invade beyond the node's capsule into surrounding tissues, creating adhesions. The tumor may trigger an intense desmoplastic reaction, so scar-like tissue formation, or extensive involvement throughout the node creates sufficient mass to restrict normal tissue movement. This fixation or immobility represents one of the most reliable physical examination findings suggesting malignancy. Experienced clinicians consider a hard, fixed lymph node, particularly one that has grown progressively larger over time, to be highly suspicious for cancer until proven otherwise. This characteristic alone often triggers expedited evaluation even when other features appear less concerning. Associated symptoms context matters for proper assessment. The fourth distinguishing characteristic involves evaluating the broader clinical context in which lymph node enlargement occurs. This holistic assessment provides crucial information about the likely underlying cause and helps determine appropriate next steps. Inflammatory lymph nodes typically appear in predictable patterns corresponding to their drainage territories. When you develop a throat infection, cervical nodes enlarge. With a dental abscess, submandibular nodes react. Skin infections of the arm may trigger axillary armpit node enlargement. In each case, the enlarged nodes have a clear reason for their activation, a nearby infection or inflammation that explains their response. Additionally, these nodes often feel tender when touched, reflecting the inflammatory process within them. Cancerous lymph nodes, conversely, may appear without any obvious triggering condition in their drainage territory. This seemingly spontaneous enlargement, particularly when it affects only one node or one group of nodes, raises concern. While some cancer-involved nodes cause pain, many remain painless despite significant enlargement, an absence of symptoms that unfortunately may delay detection and evaluation. Beyond local symptoms, certain systemic manifestations warrant particular attention when accompanying lymph node enlargement. The combination of persistent lymphadenopathy and enlarged lymph nodes with unexplained weight loss, night sweats, persistent fever, or profound fatigue, collectively known as B symptoms, in lymphoma diagnosis significantly increases cancer suspicion. These constitutional symptoms often reflect the metabolic demands and inflammatory mediators produced by certain malignancies. The constellation of features, how multiple signs increase concern while each characteristic we've discussed provides valuable diagnostic information. The true power lies in evaluating their combination. Multiple concerning features appearing together substantially increase the likelihood of malignancy and should prompt expedited medical evaluation. Consider the following scenarios with escalating levels of concern. First, a small pea-sized tender, mobile lymph node appearing during an upper respiratory infection and resolving within 2 weeks represents minimal concern. This perfectly fits the expected pattern of a normal immune response. Next, a slightly larger node, a cherry-sized without obvious infection, but which remains mobile and shrinks over several weeks, warrants monitoring, but not immediate alarm. However, a grape-sized painless fixed node that persists or grows over 68 weeks requires urgent evaluation regardless of other symptoms. The combination of large-sized tumors, prolonged duration at 21 month, fixation immobility, and absence of infectious cause represents the most concerning presentation. When accompanied by constitutional symptoms like unexplained weight loss or night sweats, the urgency for proper evaluation increases further. This constellation of features, while not definitively diagnostic of malignancy, justifies a thorough and expedited cancer workup. Remember that cancer detection isn't about absolute certainty, but rather recognizing patterns that warrant appropriate investigation. The threshold for seeking medical attention should be lower for certain high-risk groups, including those with prior cancer history, family history of lymphoma or other cancers, or immunocompromising conditions. Beyond the neck regional variations, in lymph node assessment, while we've discussed general principles applicable to all lymph nodes, certain regions deserve special consideration due to their unique characteristics and cancer associations. Understanding these regional variations enhances your ability to properly interpret findings. Cervical neck lymphadenopathy warrants particular attention given the numerous important structures in this region. While upper respiratory infections commonly cause temporary cervical node enlargement, persistent neck nodes, particularly those in the posterior triangle, behind the sternocleidomastoid muscle or supraclavicular region, just above the collarbone, have higher malignancy rates. Supraclavicular nodes especially raise concern for metastatic cancer from chest or abdominal organs due to their drainage patterns. Axillary armpit nodes typically enlarge with upper extremity infections or breast conditions. Persistent, painless axillary masses without obvious cause require careful evaluation, particularly in women, as they may represent the first detectable sign of breast cancer. Similarly, inguinal groin nodes commonly react to lower extremity or genital infections, but persistent enlargement may signal urogenital cancers or lymphomas. Perhaps most concerning are enlarged intra-abdominal or intrathoracic chest lymph nodes, which typically remain undetectable without imaging studies. These internal nodes often come to attention only when they grow large enough to cause symptoms through pressure on adjacent structures or are incidentally discovered during imaging for other conditions. By this point, they're frequently quite advanced, highlighting the importance of investigating even subtle symptoms like persistent abdominal discomfort or unexplained cough. Armed with the knowledge of these 4 distinguishing characteristics, you may wonder, when should I actually see a doctor about a swollen lymph node? While individual circumstances vary, certain general guidelines can help inform this important decision. Immediate medical evaluation within days is warranted for any lymph node larger than 2 cm is roughly grape-sized without obvious infection. Rapidly growing nodes, particularly if hard or fixed, nodes accompanied by unexplained weight loss, night sweats or persistent fever, supraclavicular nodes above the collarbone, regardless of size, node enlargement in someone with previous cancer history. Hard fixed nodes in any location. Nodes that should be evaluated within 24 weeks include any node persisting longer than a month after resolution of an infection, multiple enlarged nodes in different body regions without clear cause, nodes accompanied by unexplained skin changes or rashes, persistent nodes in adults over 40 who have higher cancer rates. For children, the threshold for concern differs slightly. Children typically develop more pronounced and numerous reactive lymph nodes than adults during common infections. Multiple small, soft, mobile nodes during childhood illnesses rarely indicate serious pathology. Very large, 3 cm hard, or fixed nodes in children still warrant prompt evaluation, as do nodes associated with unusual symptoms like easy bruising, bone pain, or prolonged fever. Diagnostic approaches. What to expect during medical evaluation. If your lymph node characteristics suggest the need for medical evaluation, understanding the likely diagnostic process helps alleviate anxiety and ensures appropriate follow-through. The evaluation typically follows a stepwise approach, beginning with less invasive measures and proceeding as needed. The initial assessment involves a comprehensive medical history and physical examination. Your doctor will inquire about the node's discovery, growth pattern, associated symptoms, recent infections, medication use, and relevant personal and family medical history. Physical examination assesses not just the concerning node but all major lymph node regions, looking for patterns of enlargement while also examining potential infection sources and other physical findings. Laboratory testing often follows, typically including complete blood count, inflammatory markers, and sometimes specialized blood tests for particular infections or conditions suspected based on your presentation. Abnormal blood counts, particularly unexplained anemia or elevated white blood cell counts, may increase cancer suspicion, while certain infection markers may support a benign inflammatory cause. Imaging studies provide the next level of assessment. Ultrasound often serves as the initial imaging modality for superficial nodes, evaluating size, internal architecture, blood flow patterns, and relationship to surrounding structures. CT scans or MRIs may follow to assess deeper nodes or evaluate for potential primary cancer sites if metastatic disease is suspected. When malignancy remains a concern despite these evaluations, tissue diagnosis becomes necessary. Fine needle aspiration, using a thin needle to remove cells from the node, sometimes provides sufficient information, but excisional biopsy, a surgical removal of the entire node, often yields more definitive results by preserving the node's architecture for comprehensive pathological examination. Conclusion: knowledge as a tool for timely intervention. Understanding the 4 key characteristics that help differentiate between inflammatory and potentially cancerous lymph nodes empowers you to make informed decisions about your health. Size, duration, mobility, and associated symptoms provide a framework for initial assessment that can guide appropriate next steps. Remember that most swollen lymph nodes represent normal, temporary immune responses to minor infections or injuries. Even persistent nodes frequently have benign causes, including lingering viral effects, autoimmune conditions, or medication reactions. The purpose of this information isn't to create anxiety, but rather to provide tools for appropriate decision-making and timely intervention when truly needed. Early detection remains one of our most powerful advantages in cancer treatment. Lymphomas and many other cancers affecting lymph nodes often respond exceptionally well to treatment, when discovered in their early stages. By recognizing concerning patterns and seeking appropriate medical evaluation, you maximize the opportunity for early intervention and favorable outcomes.